Our first guest is Lynn Moore, president of the Novant Health Ostomy Support Group. Welcome to our show today, Lynn. It's a pleasure to have you here.
Thank you. I'm glad to be here.
Great. Now, I understand that you're leading a new support group at Novant Health, and I'd like to learn more about that today. Can you share with us?
Well, sure. I'm a retired teacher, which you'll be able to tell from the way that I talk, who lives on Ocean Isle Beach. I currently volunteer at the Museum of Coastal Carolina, and I love to line dance and fossil hunt. And I happen to be an ostomate.
An ostomate, is that what it's called?
It is.
Okay.
That's what we consider ourselves. So we are folks who have had some kind of diversion, some kind of surgically created opening that collects waste. And that can be urine or it can be fecal matter. That's collected in a nice little pouch and disposed of.
And that's an ostomy. That's known as an ostomy?
That's
is that
correct?
Well, that's pretty interesting. What would the purpose of this support group be, Lynn?
Sometimes people choose to have this type of surgery done. Perhaps they've been chronically ill for a year with Crohn's disease or diverticulitis, something like that. And this is such a relief to get rid of a lot of the pain and symptoms of those conditions. Other times it's done for some kind of emergency, and a person wakes up in the hospital and says, oh my goodness, I've had this surgery, now what do I do? So there are various ways that one ends up in this condition, but nevertheless, here you are. The home health nurses will say, here's the equipment you need, best of luck, and you're on your own. Brunswick County does not have any place available where folks can go to figure out about how to live their lives as normal people again.
So it's obvious there's a great need for something such as an ostomy support group in Brunswick County. I'm curious, who can attend these meetings?
We're looking for folks who might be considering having such a surgery.
Oh, really?
Folks who are in the hospital waiting for surgery or have just had the procedure done. We're also looking for folks who've been ostomates for many years and can come and give suggestions and encouragement and say, look, I play tennis, I travel, I fly on airplanes, I've gotten married, I've had a baby. All the kinds of things that we want folks to know that normal people do. And just because you have an ostomy does not mean that you can't be part of the regular normal world.
Well, would caregivers be invited to the support group and along with family?
We would love to have a husband or wife or your partner, because it's important for those folks to know what you're going through as well. Yes. We're even encouraging anyone who's in the field, such as student nurses, who need to know and would like to know more about, yes, you can read in a book what an ostomy is, but you'd like to talk to somebody who's been through it and wears it on her body or his body every day.
Now, you said that you would talk about methods of ways to use it, different things like that, but what are some of the other topics that might be considered at the support group? Would you have speakers?
We would. We can bring in a local physician who would talk about issues such as hernias. A large portion of ostomates will develop hernias over our lifetimes, and so we need to know what to do about that. We have representatives from the 3 main manufacturers who come in and show us new products, how to better deal with the daily ostomy needs. We also have authors who've written books about why me or here's my new life, and we have one in Wilmington who's going to come and speak to our group.
Oh, that's great.
And tell us about his journey and then share his book with us.
In terms of the products that you use, are they readily available in this area, or do you find it difficult sometimes to find the products you need?
Most everything has to be ordered through catalog. So you have to have vendors available, you have to know who the folks are and what products they have. And the way to do that is to come to something like a support group and let us lay out on the table, here's what we've got, here are the new things. Would you like to try some samples and take some things home? That's where you get the knowledge, because you don't have it available at a counter at the drugstore.
Yeah, I was curious as to whether you had to order them on the internet or if you could go to your local pharmacy and get these things.
Right, things are ordered.
And something always happens. You run out of your last bags. Somehow it gets past you and you might need them.
Right, and you are in big trouble.
That's what I
Because
thought.
you can't run up to Walgreens and just say,
Really?
I need a box. No, there's such a variety of the
Okay.
products available, so many sizes,
Okay.
so many types, open-ended, closed-ended, all types of varieties. So they don't stock it. You have to order. You can get emergency order. Sometimes they'll deliver overnight for a fee, but it's something you have to be very aware of.
Would it be part of the support group's bailiwick to visit patients in the hospital? Would there be a time when you might sit with the patient to explain to them what it's going to be like when you go home?
Absolutely. The things that I can do are share my personal story. I cannot give medical advice.
No, of course
because,
not.
Right, I'm not a nurse.
No.
But I can say, these are some tricks that worked for me. Here's what brought me comfort. Here's what I did first. Here's how I got up the courage to go out to dinner.
Oh, yeah.
The first time.
Yeah.
Because I was worried. So, yes, we have to be certified through the hospital.
Of course.
As a volunteer. And so each
great.
one that wants to do that goes through that process. But
Right.
that's fine.
How often are you going to meet?
We're going to have our meetings the last Sunday afternoon of each month.
Okay.
So it'll be at the hospital from 2 to 3:30. We hope folks will have their morning activities finished, but Sunday afternoon is a pretty good time for most folks. And since we're inviting the many members of the family to come,
Right.
you can come as an outing. And so that would be the fourth Sunday from 2 to 3:30 at the hospital. We'll be in the first floor conference room.
Can you share with our viewers when the next meeting will be?
February 28th is the fourth Sunday of February.
So it's always the fourth Sunday, not necessarily the last Sunday.
Correct.
The fourth Sunday.
Once in a while, that will conflict with
Yeah.
a holiday and we'll bump 1 week earlier.
okay.
But basically, it's the fourth. We also have contact information, and I think
Okay.
that will be available through Novant and possibly through this program.
Yeah, I wanted to ask if somebody out there watching is interested in joining, how might they do that?
You can contact me, and I have a web address that is ostomyforme53 at gmail.com.
Okay.
So I set that up. Anyone that wants information.
And I suppose that they might call the hospital too to get further
Our wound
details.
ostomy nurse is Danae Cook-Blanks. She's an RN and a wound ostomy nurse. And she also has her email at the hospital, dcblanks at NovantHealth.org.
.org. Great. Well, thank you so much for coming today. It's been a pleasure to have you, and I look forward to hearing how it goes.
Thank you so much.
You're welcome.